brain controls everything that you do, from your thoughts to your actions. But in today's fast-paced digital world, are we really taking care of it? Hello everyone, I'm Saveetha Vishnathan.
And I'm Maharasi, and we are second year MBBS students. Today, we are very honored to have with us Dr. Vinoth Kanna, who's here to help us debunk some important myths about the brain health and more importantly, to provide advice on how to practically take care of our brain.
Dr. Vinoth Kanna completed his MBBS and MD from Tanjavur Medical College and went on to pursue his DM in Neurology in Madras Medical College. Currently, he's the professor and HOD at Saveetha Medical College and Hospital. Sir, thank you so much for taking your time to be here.
Thank you, Satya and Maha, for inviting for this podcast. I am very happy to share my views on brain health. Proceed.
To kickstart our first segment, it's a myths versus facts round. So I'll be stating some common misconceptions which we tend to hear from family members, relatives, or even patients that we come across in our posting time.
Okay.
So, sir, please tell us whether it's a myth or a fact. First statement being, left brain people are more logical and right brain people are more creative.
No, it's a myth. There is no left side and right side. Brain works as a unit. It works as a network. So, for example, each and every part of the brain has some specific functions. Your idea formation, creative thinking, planning and execution is done by front part of the brain, what we call it as a frontal lobe. Where vision, seeing, is done by your back part of the brain, what we call it as an occipital lobe. The side way of the brain, just above the head, just above the ear, there is a lobe called temporal lobe, which is responsible for our memory as well as hearing. And just above the top, that is over the top of the head, we call it as a parietal lobe. That is the sensory cortex, which receives the sensations, touch sensation, pain sensation, all the sensations is carried to this final pathway called the sensory cortex. And apart from the sensory information, it do visuospatial function also. So each and every part of the brain has a different function. I will explain you with an example. Recently, I met our Maestro Ilayaraja a few months back. When I met him, he was writing the notes for his symphony. In a legibly, his handwriting is like a printed one. So when I saw him, obviously as per your questions, being a creative thinker, his right side brain is dominant. It is not so. As a neurological perspective, when I saw him, he is writing the notes, writing the musical notes. The music is represented in right temporal lobe. The melody, the intonation, the rhythm, everything is represented in the right temporal lobe. And he is a creative thinking. He is writing new notes. So his frontal lobe is also coming to act. He is writing. So he is a motor act. His left frontal lobe is also acting. He is holding the pen. Sensation, everything is, he is holding the pen. All the sensations he is able to perceive. His parietal lobe is also acting. He is visualizing the letters. So his occipital lobe is acting. So each and every part of the brain, he is writing coordinately. His cerebellum is acting. So every part of the brain is acting, doing it during that act. So it is not, we cannot able to separate it as a right brain or left brain. All parts of the brain work as a unit. This is an example for you so that you can understand it easily. Right.
Statement number 2, sleeping with the phone near your head is very dangerous for the brain.
No, it's a myth. There is no specific scientific evidence to prove this. Keeping the cell phone under the pillow doesn't cause any direct damage to the brain. Because the waves generated from the phone are microwaves. They are non-ionizing radiation. They have no much power to penetrate the chemical bond or any damage the bonds between or damage the DNA. So, but there is no direct damage, but there is an indirect damage in the form of sleep disturbances. Using the phone in the night times obviously affects the sleep. The blue light, normally the phone emits the blue light. This blue light, this transmitted via the eye, and it damages a particular part of the brain called hypothalamus, which is the sleep center in the brain, which secretes a hormone called melatonin. This blue light obviously decreases secretion of this melatonin, which is otherwise known as the sleep hormone or the hormone of darkness. So a direct damage there is not, but indirectly it affects the sleep in the form of disturbed sleep. So many of the people, what we see nowadays is scrolling the phone for 5 minutes. They think that they'll scroll for 5 minutes, but over the night they will do all these things. And over a particular point of time, they'll sleep around 1 o'clock or 2 o'clock, and they become tired and go for the sleep. But this is not a good habit. So this obviously affects the sleep and decrease your attention, concentration. When you wake up in the morning, you become irritable. You don't feel comfortable when you wake up in the morning. So obviously, the usage of cell phones, the improper usage of phone, prolonged usage of cell phone affects the sleep, particularly decrease the melatonin. By decreasing the melatonin, it affects the sleep, which indirectly causes the brain damage.
Statement number 3. It's very common nowadays for people to get headaches before exams or even in minor circumstances. So does having minor headaches always mean something serious?
No, it is also a myth. Headache அப்படினாலே பயந்துக்க வேண்டாம். So there are a lot of headaches are there. Normally, the headache we usually divide into primary headache and secondary headaches. Primary headaches means there is no cause for that. There are a lot of types of primary headaches. Secondary headaches means there is a reason behind it. For example, there is an infection in the brain, there is increased pressure in the brain, there is a block in the brain, there is a bleed in the brain, any tumor in the brain, anything causing a brain damage, causing the headache, we call it as a secondary headache. We have to address the cause. But primary headache, with the help of history and the clinical examination, you can easily find out the primary headache. There is no need for any scans and all. With the age of history, for example, primary headache, there are examples for primary headache are migraine headache, tension type headache. There are a few examples of primary headache. So when you ask from the history itself, that will give, I'll give an example for this. ஒரு பேஷண்ட் வராங்க தலைவலி அப்படின்னா தலைவலி வலிக்குதா ஒரு பக்கமாக வலிக்குதா இல்லை ரெண்டு பக்கம் வலிக்குதா அப்படின்னு ஒரு பக்கமாக தான் வலிக்குது எவ்வளோ நேரம் வலிக்குது கொஞ்சம் நேரமாக வலிக்குது சரி எதுவும் வாமிட் கூட இருக்கா அவங்களுக்கு இல்லை ஏதாவது வெயிலில் போனால் வலிக்குதா தலை குளிச்சா வலிக்குதா டென்ஷனானா வலிக்குதா தூக்கம் இல்லைனா வலிக்குதா நேரத்துக்கு சாப்பிடலைனா வலிக்குதா அதிகமான வெளிச்சம் அதிகமான சவுண்டு சென்ட் வாசனை பூ வாசனை ஏதாவது இருந்தால் உங்களுக்கு தலைவலி அதிகமாகுதா மென்சஸ் டைம் லேடிஸாக இருந்தால் மென்சஸ் டைமில் அதிகமாகுதா உங்கள் ஃபேமிலியில் யாருக்காவது தலைவலி இருந்தால் உங்களுக்கு அது மாதிரி இருக்காங்களா யாருக்காவது உங்கள் ஃபேமிலியில் உங்கள் அக்கா தங்கச்சிக்கு யாருக்காவது இருக்கா உங்கள் அப்பா அம்மாவுக்கு இருக்கா தலைவலி இருந்துச்சா இந்த மாதிரி பேஸ்ட் அப் அந்த கொஸ்டின் we can able to come to a conclusion whether this is a primary headache or a secondary headache. So இந்த மாதிரி question கேட்டாலே ஈஸியாகவே we can able to identify and with the small clinical examination we can easily identify the primary headache and we can tell them there is no need for scanning. பயந்துக்க வேண்டாம் உங்களுக்கு ஸ்கேன்லாம் தேவையில்லை உங்களுக்கு இந்த மாதிரி தலைவலி தான் மைக்ரேன் தலைவலி தான் டென்ஷன் டைப் ஹெடேக் தான் உங்களுக்கு மாத்திரை கொடுத்தாலே சரியாயிடும் அப்படின்னு we can able to console them and we can happily treat them. So tension, we are seeing many patients now it is an exam time, so many of the students 10th standard students 12th standard students are coming with headache primarily because of fear of exams. அது எப்படி எக்ஸ்பிரஸ் பண்றதுன்னு தெரியாம they come with தலைவலிக்குது. So parents are get panic. அவங்க நிறைய பேர் for the last 1 month we are seeing a lot of students coming with headache. So that is called as tension type headache. So with the help of history itself we can able to identify that இது சாதாரண tension type headache தான். இது ஒண்ணுமே இல்லை, நீ பயந்துக்காத, உன்னால முடிஞ்சதை பண்ணு, பரிசத்துக்கு நல்லா படி. ஸோ இது மாத்திரை போட்டால் சரியாயிடும், இப்போதைக்கு மாத்திரை கொடுக்கலாம், கொஞ்ச நாள் கழிச்சு அதுவும் சரியாயிடும். ஸோ with the easy consolment, with the ease of history we can able to diagnose history. So all the headache are not serious. ரொம்ப பயந்துக்க வேண்டாம். Headache simple thing தான். We can easily if we identify the cause we can easily able to treat that.
Statement number 4, stroke always happens only in old people.
It is also a myth because we are seeing a lot of young stroke patient nowadays. What is young stroke? Young stroke is nothing but stroke in less than 40 years of age is called young stroke. So because of this prevalence of high risk factors like diabetes, hypertension, dyslipidemia in the younger age group, we are getting stroke nowadays we are getting young stroke patients. In our ward itself, in neurology ward, we have a stroke ward. In that almost 15 patients we have. In that 6 patients are of young stroke, less than 40 years of age. They're all having diabetes, hypertension. So and family history of stroke is also there. And apart from these risk factors, the substance abuse like smoking, alcohol, other substance abuse can also cause stroke. So we are seeing nowadays there is a change in the scenario because of the change in the life habits, change in the sleep pattern, change in the food habits. Everything come into account in this and getting young stroke nowadays, a lot of young stroke nowadays coming to our neurology department.
As a follow-up question to our discussion on young strokes, I recently came across an article which said that strength training, especially weightlifting, improves the longevity of our brain cells. So how true is that according to neurology?
Yeah, it's a very good question. Exercising the muscles, does it cause brain development? Does it cause brain? So that is a word called neuroplasticity. Neuroplasticity means getting new connections in the brain. For example, when you take a stroke patients, what is stroke? Normally we see one right hand and one right leg is not working. So this part of the one half of the body is not working. We call it as hemiplegia. We call it as a stroke. So for that patient, we do some training. So we do a physiotherapy by active movements and passive movements. So one part of the brain get affected, that part won't act. So the part of the brain which gets involved in the stroke doesn't work. The area surrounding this affected part begins to work. So how it works, that is called as neuroplasticity. By doing some exercises, active exercises or passive exercises, the areas surrounding the affected area get stimulated, the network become increased, they begin to work. So gradually they begin to move. So automatically the motor movements will begin to occur. So gradually they will recover from the stroke. This is called as neuroplasticity. Similarly, any patient, even for non-stroke patients, doing an exercises in the gym, increasing the muscle mass, increases the brain longevity. There are certain factors called brain-derived growth factors, insulin-like growth factors. There are certain factors which are stimulated, which are recovered during the exercises. During these exercises, automatically these neurotropic factors stimulate the brain and increases the neuroplasticity. So a lot of network synaptic connections will increase, the brain will get more activated, the attention become more, concentration become more, memory will be increased, concentration will be increased, vigilance will be more, and they have focused attention. If you see in your student group itself, if you see a lot of students who are going for a gym, their attention will be more. They have a good sleep time, they have a good food habits. You can see them. So going the gym goers always have a healthy lifestyle. So for them, their longevity is more. The brain development is also more. Memory is also more. So doing an exercise helps for not only for the muscles but also for the brain also.
And finally, statement number 5. Forgetting things occasionally means you have a memory disorder.
No, it's a myth. Forgetting things in the older age group is quite common. Like that graying of your hair, wrinkling of your skin. Like that, misplacing the keys, cannot be able to remember the names. Everything is quite natural in the old age group. But when it is important, when it is affect your day-to-day activities, if your memory disturbance affects your activities of daily living, for example, if they keep on repeatedly asking the same questions, எப்படி பேஷண்ட் கேட்பாங்கன்னா நான் சாப்பிட்ருவாங்க காலம்பரை சாப்பிட்டுட்டு எனக்கு சாப்பாடு கொடுங்கன்னு திருப்பி கேட்பாங்க. ஸோ தட் இஸ் a memory disturbance. இப்போ வீட்டிலேருந்து வெளியில் போயிடுவாங்க. when you go to the outside, in familiar surroundings தான் இருக்கும், அந்த தெருவில் தான் போயிருப்பாங்க, பட் அவங்களுக்கு வீட்டுக்கு வர தெரியாது. they cannot able to come back to their home. that is a memory disturbance. உங்கள் ரிலேட்டிவ்ஸ், க்ளோஸ் ரிலேட்டிவ்ஸ், அப்பா இருப்பாங்க, பையன் இருப்பாங்க, சித்தப்பா இருப்பாங்க, அவங்க பேரே மறந்துடுவாங்க. ஸோ வெரி க்ளோஸ் ரிலேட்டிவ் தட் ஃபர்கெட் தட் நேம்ஸ். தட் இஸ் அ மெமரி டிஸ்டர்பன்ஸ். ஸோ வீட்டில் வந்து எங்கே டாய்லெட் எங்கே இருக்குது, பாத்ரூம் எங்கே இருக்குது, கிச்சன் எங்கே இருக்குன்னு தெரியாது. சமயத்தில் தெரியாமலே யூரின் போயிடுவாங்க. தட் இஸ் அ மெமரி டிஸ்டர்பன்ஸ். ஸோ these are all significant. So all the memory disturbances we cannot take into account. Simple things we can ignore. But if it affects his activities of daily living, day-to-day activities affect பண்ணுது அப்படின்னா, it is purely a memory disturbance. We have to consult a neurologist for this.
That was a very interesting segment where we were able to debunk a lot of common misconceptions. Let's move on to the next segment.
In today's lifestyle is very different from what our ancestors would have led. How is increasing screen time, attention deficit, social media, as well as increasing stress levels, what is its impact, this modern life and its impact on brain health?
Obviously, this modern lifestyle is impacting our lifestyle. Seeing the cell phone continuously affects attention. I'm seeing a lot of children having this attention deficit, concentration deficit. Even children having a cell phone for themselves. Apart from the parents, mother and father having a cell phone, the child themselves having a cell phone, because all the school activities and academic activities, school homework are given through the cell phone. Once they start seeing the cell phone, they see the reels immediately. They keep on seeing the reels. What is that? It is given immediate satisfaction, immediate gratification, immediate dopamine surge. So because of that, they keep on doing that. Immediate satisfaction causes them to keep on seeing the reels. So if the same student, if you ask them to read for some time, even they can be able to read for 10 minutes. Within 10 minutes, they want to search for the phone, because they need a relief, they need a satisfaction for that, need a gratification for that. So the reading needs a sustained attention. Ask him to read for 30 minutes. He cannot able to do that, because of the reels has distracted his attention. So usually you should not give the phone to the children, and if they see the reels, ask them to reduce the screen time. For example, 30 minutes a day, more than enough. This is more than enough for you. Or I'll ask the students to follow this Pomodoro techniques. What is Pomodoro technique means? Read for 25 minutes, relax for 5 minutes, then again read for 25 minutes, relax for 5 minutes. So this will keep them engaging. Then they can go for a long duration of study. So this is a technique. Another technique is called Feynman's technique. Feynman's technique is you read the book, close the book, and just recall yourself what you have read, and teach your fellow students. So like a simple language, try to teach them. So this will maintain your registration of the subject. So this is for reading. But cell phone usage definitely decreases the attention, definitely decreases the concentration, definitely decreases the vigilance, and they cannot able to concentrate, they cannot do a long duration of studies. This is affect their career also. So I strictly advise the parent to keep the cell phone away when they are reading, and stop avoiding seeing the reels, have a limited screen time. That will help for the brain health as well as his lifestyle.
As the next question, sleep is something we tend to compromise on a lot, especially for youngsters and for students who have very hectic academic schedules. So, sir, could you please tell us some piece of advice on how to maintain a proper sleep hygiene, sleep schedule, and how sleep could potentially impact our brain health?
This is a very good question because the sleep is the main prominent symptoms. Sleep disturbance is a symptom we are facing nowadays in the OPDs. Insomnia is the commonest complaint even for the younger age group as well as the older age group. So I will tell you something about sleep hygiene. What is sleep hygiene? So sleep hygiene means you have to take the dinner at least 2 hours prior to sleep, 2 to 3 hours prior to sleep. Then only your digestion will be okay and sleep will be get proper. And during the sleep, before the sleep, use just yellow light. Instead of using a white light in the rooms, use that yellow lights. Like a sunset. Sunset is a yellow color. So similar to that, your brain get adapted to the yellow color so that it begin to go for a sleep. So there is an hormone called melatonin hormone. This hormone is otherwise known as the sleep hormone or the hormone of darkness. This melatonin hormone is secreted around 7 to 9 o'clock in the evening. So it stimulates our body to go for the sleep. This stimulation occurs whenever there is no bright light surrounding you. Whenever there is a white light, automatically the melatonin secretion will be reduced. Whenever there is a yellow light, that will be okay for you. So this hormone melatonin pushes us to the sleep. So when you go for the sleep, normally what is called a sleep latency. When you go for the sleep to the bed, within 20 minutes we have to sleep. That is called as a normal sleep latency. Going to the bed and going to the sleep, first stage of sleep. There should be a normal latency of 20 minutes. This is normal for everybody. 20 to 30 minutes is a normal latency for everybody. If we go beyond that, there is a sleep disturbance. Okay. So go for the sleep. There are few stages in the sleep called NREM sleep and REM sleep. NREM sleep is a sleep that is a deep sleep. REM sleep is a rapid eye movement sleep which comes in a cycle. So first there is an NREM sleep. After 45 minutes there is a REM sleep. After that an NREM sleep, REM sleep, NREM sleep, REM sleep. So there will be 3 cycles throughout the whole night. Normally, the sleep duration should be around 6 to 8 hours. 6 to 8 hours. During that, 3 cycles of NREM and 3 cycles of REM will happen. We can also have dreams during that sleep. What is happening nowadays, if you have a proper sleep, you will have your attention span will be okay, your concentration span will be okay, your vigilance will be okay, your memory will be okay, you are feeling fresh in the morning, you can able to do all the activities. So this is a normal sleep pattern. So what is happening nowadays is the sleep habit is totally changed now. All of the students are like owl. Owl means they are waking up in the night and sleeping in the early morning. So they are reading and they are seeing the cell phones. They are going to sleep by around 1 o'clock or 2 o'clock in the morning. They wake up around 8 o'clock or 9 o'clock in the morning. They feel dull when you wake up. That usually as a long term, their attention span is reduced, memory capacity everything is reduced. So these are all sleep disturbances. These are all the effects of the sleep disturbances. Apart from that, I'll tell you about the hormonal changes in the sleep. During the sleep, there are certain beautiful hormones that is called as anabolic hormones are secreted, like growth hormone, insulin-like growth factors, prolactins, testosterone. These are all very good for our human health actually. If you don't sleep normally, there will be increase of another hormone called cortisol, which is a bad hormone for us. If there is an increase in the cortisol level, automatically over a course of time we'll get diabetes, hypertension, dyslipidemia, obesity, all these changes. So the changes in the hormonal level also occurs when there is a lack of sleep or a disturbance in the sleep. So the sleep is much important for all of us, for all of you students, as well as for the older age group. Even older age group people, individual also, what they do, they scroll, they play the games in the night, they don't sleep properly, they got insomnia and they come to the doctor, they ask that they cannot able to sleep normally. I use the phone for lack of sleep, but I couldn't be able to concentrate myself. All these are due to lack of sleep. But try to sleep normally. At least 6 to 8 hours of sleep is a must for all of you because sleep is a very good protective mechanism in your human body. For all of you students, your memory consolidation, everything occurs during the sleep. Your energy conservation, everything occurs during the sleep. So I advise you to sleep for 6 to 8 hours. So I am seeing many students who are during the exam time, they'll read all over throughout the night and they go to the exam and they vomit out whatever they read in the early day, first day. It should not happen like this. Many of the students are using this hormone tablets for sleep during the time of exams. It is not at all advisable. Read daily, have a good sleep, then only you are able to maintain a good healthy life habit.
I think a
a lot of MBBS students like me and Maha, we watch medical shows like Grey's Anatomy and Doctor House. So we are inspired by watching these characters. We want to become neurologists or neurospecialists, neurosurgeons. However, we don't know what the path looks like in real life. So what is it that inspired you, sir, to choose neurology as a specialty specifically?
I am more passionate about this MD general medicine. I was not much about which branch I am going to do. First time my thought was in cardiology, and neurology was not in my mind during my days. But during that period of this 3 years, a lot of things has influenced me to towards neurology. First of all, the teachers. The teachers are the main driven force for me to took neurology. So all the neurologists, they speak like anything. They'll speak like a few words, we cannot able to imagine that. And they diagnose with ease all the cases. They'll let patient tell a lot of complaints, but they'll put a simple diagnosis like that, and they'll dissipate the patient. So cardiology is also interesting, but neurology professors are the main driven force for me. And apart from that, patients, neurology is like a mathematics. So whenever we can able to clinically identify it, then you can go for the radiology, imaging, that is MRI or anything, we can able to find out easily. So whenever you localize something in the human body after seeing the patient have a complaint, you localize something and you localize that some part of the brain is involved. This is the lesion which is causing this clinical findings. Then you correlate with the radiology, automatically it will be there. Neurology is the only super specialty which is still have the clinical acumen. There is no, without any imaging also we can able to diagnose that. So even though a lot of advances has come in the radiology department, neurology is the only super specialty which is still having the clinical acumen. So that the patients as well as the professors and the neurology is like your brain is a magical box, like the Pandora box. That is like a magician. I was fascinated by the brain activities. It can do everything. It controls all part of our system. It controls the heart, it controls the lungs, it controls the kidney, it controls the intestine, it controls the bladder, it controls the movements of the sexual activities. Everything is controlled by it. It is a master gland. It's a master. When you say only one organ, particular organ means the brain is the first organ, I'll tell. So that is, I was fascinated by this brain activities. It can do this motor, sensory, memory, attention, concentration, this visual, auditory, visuospatial functions, emotional disturbances, emotional changes, all these are concerned with this brain. So multitasking, multiple areas. There are very, very specific areas in the brain we can do all the activities. So I am fascinated by the brain. So that leads me to the neurology.
Sir, I'm sure during the initial stages of your journey, there would have been a lot of milestones which you still try to remember and reflect upon. So is there any such patient encounter that you still remember and has had a lasting impact on you?
After finishing my neurology course in Madras Medical College, I was posted in government health center actually in Manargudi. In that, patient had a stroke. Clinically, patient cannot able to walk. Patient has a difficulty in one side of the body. The patient came within 1 hour. So within 4.5 hours, if any stroke patient, we call it as golden period. There's a window period. So within 1 hour, I saw the patient. So I searched for any drugs which is available for. There is a block in the brain, probably. So I do the scan immediately. There was nothing in the scan. Supposed to be there is a block in the brain. So if we act fastly, we can able to save the patient. We can able to break the clot in the brain. There is a clot in the brain which is causing this damage. We can able to lyse the clot. So I have to act fast. I asked for the drug was not there because I was the first neurologist there actually. Then what I do, I asked my cardiologist friend, he had a thrombolytic agent. They have a 40 milligram of tinectic place. That is a drug we use. So in that we don't need 40 milligrams. We need only 15 milligrams. Wastage is there. The hospital supported me. So I took that 15 milligrams. In the CT room itself, I thrombolized the patient. I lysed the patient. I gave the drug to the patient, and immediately after some time in the evening itself, the weakness improved. Without 0/5, the patient totally cannot able to lift him. He started moving the limbs. He started moving the legs, and within 1 day, he can able to totally become normal. The attenders, everybody was happy with that. I was also totally happy because that was the first thrombolysis done in the district and the entire few districts. So I was happened to expose that in a next meeting. Then it was happened on Friday, and the Sunday I was supposed to have a talk. So in that I posted that stroke patient and also posted the recovery. All the doctors saw that, and the next week itself I received more than 6 cases of stroke and thrombolysis, more than 10 cases of stroke and thrombolysis more than 6 cases in 1 week. That was the real scenario. We can read everything. We can read a lot. We can read everything. but applying practically give us the more confidence as well as the more joy for us. So after 3 years of neurology, within few months itself, I can able to thrombolize a patient. I was the first to thrombolize a patient and can able to thrombolize a lot of patient within a few weeks. There's a very, very satisfying result, and I was very much satisfied with my neurology acumen, what I get in my Madras Medical College. So that was the first. Still, I have that video of that patient. Whenever I used to talk, have to have a stroke talk, and that I used to put that video because I have a good remembrance for the patient. And this was some of my. Now I have thrombolized a lot, hundreds and thousands of patients. In our medical colleges, in the Saveetha medical college, we are thrombolizing at least 2 to 3 patients per week. But the first is always the best. That is the best remembrance for me.
Thank you so much, sir, for sharing your insights with us. I'm sure this has not only been an enlightening and thought-provoking conversation for me and Maha, but for our viewers also.
We hope it's clear from today's discussion to our viewers that our brain is at the center of everything we do, what we think, what we feel, and our entire day-to-day life activities. So taking care of our brain health isn't optional, it's essential. And at the end of the day, it all dwindles down to only one thing, self-control. So from today, from this moment, let's all be very mindful about our brain health. Thank you.
Thank you.
Thank you.